What is kidney dialysis? A lucrative industry. What is diffusion, hemodialysis and peritoneal dialysis? In Australia, Canada, the United Kingdom, and the United States, dialysis is paid for by the government for those who are eligible. This makes it an attractive industry. In medicine, dialysis is the process of removing excess water, solutes, and toxins from the blood in people whose kidneys can no longer perform these functions naturally. This is referred to as renal replacement therapy. The first successful dialysis was performed in 1943. Dialysis may need to be initiated when there is a sudden rapid loss of kidney function, known as acute kidney injury, or when a gradual decline in kidney function, chronic kidney disease, reaches stage 5. Stage 5 chronic renal failure is reached when the glomerular filtration rate is 10 to 15% of normal, creatinine clearance is less than 10 ml per minute and uremia is present. Dialysis is used as a temporary measure in either acute kidney injury or in those awaiting kidney transplant, and as a permanent measure in those for whom a transplant is not indicated or not possible. In research laboratories, dialysis technique can also be used to separate molecules based on their size. The kidneys have an important role in maintaining health. When the person is healthy, the kidneys maintain the body's internal equilibrium of water and minerals. Dialysis works on the principles of the diffusion of solutes and ultrafiltration of fluid across a semipermeable membrane. The two main types of dialysis, hemodialysis and peritoneal dialysis, remove wastes and excess water from the blood in different ways. Hemodialysis removes wastes and water by circulating blood outside the body through an external filter, called a dialyzer, that contains a semipermeable membrane. In peritoneal dialysis, wastes and water are removed from the blood inside the body using the peritoneum as a natural semipermeable membrane. Wastes and excess water move from the blood, across the peritoneal membrane and into a special dialysis solution, called dialysate, in the abdominal cavity. What is diffusion? Diffusion is the net movement of anything from a region of higher concentration to a region of lower concentration. Diffusion is driven by a gradient in concentration. Hashtags dialysis, medicine, diffusion, hemodialysis, peritoneal, lucrative industry. What is kidney dialysis? A lucrative industry. What is diffusion, hemodialysis and peritoneal dialysis?